Assalamu alaikum. Now I'd like to talk about the initial management of the ischemic stroke. How to diagnose a case of ischemic stroke? First of all, if a patient comes with hemiplegia or hemiparesis for some for few minutes or some hour, he's unable to move his right or left arm, left leg, this type of feature, and you do physical examination and you get knee jerk, exaggerated ankle jerk, exaggerated and plantar extensor. You go through full neurological examination and find out that this is a stroke. And the next thing all you have to do is to do a non-contrast CT scan of the head. If I do a non-contrast CT scan of the head, we get hypodensity. Hypodensity over the affected area, and if we get hypodensity over the affected area, at that very time we get confirmation that this may be the case of ischemic stroke, and we have to look for time see symptom onset. If it is less than 4.5 hour, you can do thrombolysis by giving TPA. That means tissue plasminogen inactivator, altiplase, retiplase, inactiplase. And if it is more than 4.5 up to 24 hours, then the patient is not eligible for thrombolysis. In both cases, you have to order what you have to order: CT angiogram of the neck and head, CT angiogram of the head and neck. Why we are doing that? To find out if there is a large vessel obstruction present or not. If there is large vessel obstruction, you should do mechanical thrombectomy. If there is not involvement of the large vessel, then you should give post ischemic stroke management like antiplatelet drug and investigate for embolic source. And the patient, if the patient is hypertensive, give antihypertensive drug. If the patient is diabetic, manage diabetes. And if it is more than 24 hours and the patient is again not eligible for thrombolysis, then you need to do the standard protocol. Then you need to go through the standard protocol like altiplase. Sorry, then you should go standard post uh, ischemic stroke management. What is the inclusion criteria of these thrombolysis? Ischemic stroke with disabling neurodeficit. Ischemic stroke with disabling neurodeficit and symptom onset less than 3 to 4.5 hours before treatment initiation. And strict exclusion criteria for thrombolysis, for thrombolytics in stroke is ICH, intracranial hemorrhage on CT scan, history of history of intracranial hemorrhage, or suspected subarachnoid hemorrhage. Ischemic stroke in the past 3 months, intraaxial neoplasm, recent intracranial or intraspinal surgery, blood pressure more than 140, 185 by 110, current anticoagulation use, with INR more than 1.7, PT more than 15 seconds, and active PTT, and glucose less than 60 milligram per dl, and platelet less than uh, 1 lakh. And this is all about the management of ischemic stroke. Hope you enjoy.